I am Dr. Suraj Pratap, pediatric hematologist oncologist at Cure for the Kids Foundation. So my general motto in treating children with cancers is to be mentally and physically prepared to meet the need of the patient. And these needs change a lot during the therapy. When a new patient with, say, a leukemia is identified, the priority there are slightly different. We need to stabilize the patient. We need to use all the diagnostic modalities available to us to reach a definitive diagnosis and start the treatment of cancer. And in choosing that treatment, we use evidence-based medicine. If it's a toddler, I want to make sure that the child is meeting the milestones. The child is able to stand with support, able to walk, things like that. And similarly, as you progress through the phases, when you are seeing a teenager, they will have different requirements. They have social requirements, they have emotional requirements. You want to make sure they feel integrated with their friends, they are able to attend school. You want to make sure if they require IEPs for school, we have the ability to provide those. So you meet those requirements. And we often say that once a child comes to hem-onc, they stay with hem-onc for forever, because even after they're cured, we like to follow them up because we are more capable of monitoring for late side effects and long-term toxicities than other providers, and even as compared to adult physicians sometimes. There is a phrase we often use is that children are not small adults, and that is true at a clinical level, at a level of biology, and then even going down to the molecular level. We see that the molecular mutations that determine the outcome of cancer are different for pediatric age group as compared to adult. So someone who is specialized in pediatric oncology should be the only person taking care of a pediatric oncology patient. And on top of it, when we treat a pediatric patient, we need support system that sometimes is not available for adults. For example, I see a 5-year-old child with leukemia. Not only do I need a great team of medical providers and nurses, I also need a great team of psychology providers. I also need a great team of physical therapy, occupational therapy. I also need a great team of teachers who can accommodate the child's needs when they are out of school sometimes for weeks at a stretch. I think I do want to give a shout out to the team at Cure for the Kids. I find this foundation amazing, and for the huge population of the greater Las Vegas area and the neighboring small cities, if you look at the population, that's somewhat of a huge population. I think it's over 2 million. So this foundation has been doing this amazing work for more than a decade now. And really, if Cure for the Kids was not here, most of the oncology patients of this area would be traveling 4 hours either to Los Angeles or traveling 3 hours to Utah. I have really enjoyed the structure of the organization and the camaraderie of the different teams.